yosi, vape at alak, at kung ano ang epekto nito sa ating mga kabataan at kung ano yung pwede nating gawin bilang polisiya at ngayon dahil panahon ng eleksyon. I will, with no further ado, I would like to ask our resource persons to give their messages, starting first with our host this morning, of course, the President of the Philippine Medical Association with more than 50,000 active members. Palakpakan po natin, Dr. Hector Santos.
Magandang umaga po at kami po ay nalulugod na makasama kayo dito. Ito po ang tahanan ng Samahan ng Manggagamot sa Pilipinas or Philippine Medical Association. Magandang umaga ho and welcome. Kami po ay nakikibahagi, una pa mula doon sa Syntax Coalition. At ito nga ho ay importante sa amin, mga doktor, ang pagpapahalaga sa kalusugan ng ating mamamayan. Sapagkat malaking pahamak ang yosi, vape at alak. We, the Philippine Medical Association and other medical societies, are uniting to declare a youth epidemic on cigarettes, vape, and alcohol. Smoking is the leading cause of preventive diseases and death in the world. Countless studies have already proven that smoking reduces an individual's life expectancy and overall quality of life because they would increase the risk of contracting chronic, non-communicable diseases brought by smoking. Smoking increases the risk of cardiovascular disease and its complications, such as stroke and heart diseases. And of course, we all know it also causes cancer, mostly of the lungs, but almost all over the body would be have adverse effect and cause cancer in these parts of the body. And this is one of the major cause of death for both men and women. Dahil nga napatunayan na ang kasamaan ng pagsisigarilyo, promote naman nila ngayon ang vape. Vape is an e-cigarette which is an electronic device that lets you breathe in vapor rather than burning the tobacco to inhale smoke. Which is why the activity of using e-cigarette is known as vaping. E-cigarettes and vaping have been shown to have also adverse health conditions, including e-cigarette and vaping use-associated lung injury or E-valley. So, ng mga nakaraang 3 hanggang 5 taon, napatunayan na ito na ho ang nagiging problema ng mga nagbe-vape. E-valley or vaping use-associated lung injury. Maliban sa paninira ng iyong baga, ito rin ho ay napatunayan nagdudulot ng sakit sa puso, myocardial infarction, and also stroke. There have been cases documented in medical journals which reveal possible association between vape and the development of associated lung injuries and the heart. And this is why we say there is no risk-free e-cigarettes. When it comes down to it, there is no safe way to vape. Lalo nga ngayon, natatakot kami na kung ano-anong idinadagdag doon sa vape na to, kuminsan meron pang cannabinol at kuminsan kung ano pa yung mga poisonous materials na nakikita natin sa vape. No? On alcohol, we, the doctors of PMA, are one with you in raising the awareness of the bad effects of excessive alcohol consumption. There are readily established scientific studies and facts which point to the harmful effects of excessive alcohol consumption. Drinking too much can affect your concentration, your judgment, mood, and memory. It increases your risk for having a high blood pressure, stroke, and developing anemia. According to FNRI study, the number of adolescents consuming alcohol monthly doubled in 2 years. It rose from 1.06 million in 2021 to 2 million in 2023. The number of adolescent smokers also doubled. It rose from 500,000 in 2021 to 1.6 million in 2023. As medical professionals, we are witness to all the ill effects of alcohol, and physicians end up treating the end result. Kami po ang nakita ng mga nagkaroon ng injury from unhealthy alcohol intake. I have personally treated alcohol-related injuries in motor vehicular accidents from people who are driving under the influence of alcohol. Those involved in violent crimes and fights brought about by alcohol often end up with a variety of injuries. Kung kaya po, the medical community is calling on our government to address the epidemic of alcohol, vape, and tobacco. Nagkakaisa ho kami. And we would like you, the government, to implement more laws, possibly raise taxes on these harmful products. We also call on the candidates of the coming midterm elections to include health taxes as a cornerstone of their agenda and to improve delivery of health delivery laws. Tayo po ang PMA. Kami po ay nagkakaisa upang maghatid ng kalusugan para sa lahat. Ating tigilan ang epidemyang ito ng tobacco, alcohol at vape. Salamat po.
Maraming salamat, Dr. Hector Santos ng Philippine Medical Association. Ang ating mga doktor na nandito ngayon ay mga testigo sa harms ng alcohol consumption, yosi, vape at alak. Sinabi rin ni Dr. Hector Santos na kailangan magkaroon ng mga polisiya in order to address this problem, especially among young people, kasama dito ang pagpapataw ng buwis sa mga produktong ito. Maraming salamat, Dr. Hector Santos. Ngayon naman, mula sa Action for Economic Reforms, palakpakan natin Mr. AJ Montesa.
Good morning, everyone. It's an honor to take a stand along with our esteemed medical experts, public health advocates, and concerned citizens as we confront a growing crisis, one that threatens not only the health of our young people, but the future of our nation. We have just heard from the President of the Philippine Medical Association about the devastating health consequences of alcohol, tobacco, and vape use among Filipino youth. The evidence is clear. This is an epidemic, one that demands immediate policy action. As an economist, I am here to tell you that failing to act now will cost us dearly in lost lives, lost productivity, and a collapsing healthcare system that will not keep up with the burden of preventable diseases. We are sounding the alarm, not just on rising consumption among young people, but on a direct policy threat to us today. House Bill 11360, or the Syntax Sabotage Bill. If passed, this bill will make cigarettes and all tobacco products more affordable, undoing years of progress in reducing smoking. The numbers are staggering. Over the next decade, we would see an additional 1.86 million smokers, including young people. And the government would stand to lose 176.5 billion pesos worth of revenue, money that is meant to fund the healthcare system for Filipinos. In short, this bill will weaken our defenses against this public health crisis. And tobacco is not the only concern. Let's talk about alcohol. The Philippines has among the cheapest... And tobacco is not the only concern. Let's talk about alcohol. The Philippines has among the cheapest prices of alcohol in the world. And this affordability and accessibility comes at an enormous cost. 1 in every 5 deaths among young people is linked to alcohol harms. Alcohol contributes to more deaths and disability among people under 30 than any other risk factor. It's a major cause of cancer, which is one of the top killers of Filipinos every year, over 3,500 deaths annually. In fact, alcohol is also linked to injuries that don't require you to consume alcohol, such as road crashes and domestic violence. What is the economic cost of allowing this crisis to continue unchecked? 1.05 trillion, or 5% of our GDP. That is the estimated burden of tobacco, vape, and alcohol consumption on our economy. This number will only grow if we fail to act now. Alarmingly, the prevalence of both alcohol and tobacco consumption among young people, so people younger than 20, has actually doubled between 2021 and 2023 according to the National Nutrition Survey. But we're not here just to diagnose the problem. We're here to demand the solution. And the solution is clear. We must raise taxes on tobacco, vape, and alcohol. Higher taxes are a proven tool to reduce consumption, especially among young people, while also generating the revenue we need to fund our public healthcare system. Sa ating mga kandidato ngayong 2025, ang hamon namin ay malinaw. Maninindigan ba kayo para sa kalusugan ng publiko? O papanig kayo sa mga industriyang kumikita mula sa sakit at pinsalang dulot ng yosi, vape at alak? Kasama ng mga medical societies at health advocates, nananawagan kami sa susunod na kongreso. Itaas ang buwis sa yosi, vape at alak. Protektahan ang mga kabataan at siguruhin ang kinabukasan ng ating bayan. Maraming salamat po.
Maraming salamat, AJ Montesa mula sa Action for Economic Reforms. Very alarming, 1 out of 5 deaths among young people are attributable to alcohol harms. Kaya ang laking pahamak talaga ng yosi, vape at alak, especially among young people. At kailangan na itong i-address. No? Ngayon naman, mula sa Philippine Pediatric Society, let us all welcome Dr. Riz Gonzalez.
Magandang umaga sa lahat. Today, as a pediatrician, on behalf of the Philippine Pediatric Society, I am speaking in front of you to sound this alarm and a call for help, especially from our officials and legislators, that we are faced with an epidemic among our Filipino children on the increased use and their exposure to cigarettes, vapes, and alcohol, which impacts their health as well as their environment. Our gains in significantly reducing the smoking prevalence as we adhered to the WHO FCTC, that's the Framework Convention on Tobacco Control, being one of the country signatories from 2009 to 2021, which has shown significant reduction, unfortunately is being eroded. And this has been shown by our current FNR survey in 2023. There is an increasing prevalence of young smokers. And sad to realize that these are mainly among the poor sector of our society. What does this mean to us? The risk for non-communicable diseases is there at an early age. And sad to say, they are the sector in our society who have lesser health access. The top 5 causes of mortality has always been the same and has been linked to smoking as a risk factor. Ischemic heart disease, mga sakit sa puso, cancer, lahat ng uri, pati stroke. Yan po ay lahat gawa o naipupush ng exposure at paggamit ng sigarilyo. Paano naman ang e-cigarettes? Mas nakakabahala kasi mas mataas ngayon ang paggamit ng e-cigarettes sa ating mga kabataan at ito'y pinapakita ng Global Youth Tobacco Survey noong 2019 pa na 14% mas mataas pa sa paggamit ng sigarilyo. Palagay ko, nung pandemya at sa panahon na ito, mas mataas pa sa ating mga kabataan ang nalululong at gumagamit ng vapes. There are lots of social media channels being utilized to promote and interact with the consumer and increase user engagement, targeting the young population. Our current RA 11900, the vape law of 2022, has weaknesses and urgent needs to amend to curb this vape epidemic. Do not forget, we have 1 death of E-Valley last April 2024. A young male from Laguna, sporty, healthy, no comorbidities, no COVID, and yet he died of acute lung injury coupled with myocardial infarction. That is not even laced with tetrahydrocannabinol and vitamin E, which is being reported in the United States. So this is actually a call and a sound of alarm for all of us. We may not be recognizing E-Valley, which is not investigated nor reported, which does not result to death, but we have to be aware that this is happening. Our DTI may have prohibited the online sales last July 2023, but there are still so many vape shops which have proliferated even as 24/7 shops. What does this imply to our teens and young adults? Vape is a necessity since they are open 24/7 like convenience stores. Is age verification really implemented and clearly seen in these shops? And quite disturbing is the proliferation of these disposable vapes, which is the most popular e-cigarettes in the young. They are available, they are attractive, they are accessible. With this increased use, we are faced with single-use plastic waste, electronic waste due to the lithium battery of these devices, not to mention that e-liquids can leach into our soil and harm the ecosystem. This is the environment of our children which we will bestow. For cigarettes, look around the retail shops and you see smaller packs of tobacco in 6, touted as kiddie packs at eye level, hence making cigarettes more accessible, attractive to our young and marginalized. Alcohol consumption is increasing. Our DOST has actually documented 10 years old having access to alcohol already. The adolescents' risk-taking behavior is there. I call it their biologic vulnerability. They are prone to highly episodic drinking. And please take note, science have told us and have evidences that any amount of alcohol makes them at risk of unsafe driving, plus the early toxic effects of alcohol in their developing brain and body. Beyond illnesses, children are also victims of road crashes, domestic violence, cases that are worsened by alcohol consumptions. These flavored vapes, social media promotions, cheap alcohol and vapor products are specifically designed to hook the next generation. These are children. Without urgent government intervention, this crisis will spiral out of control. We need to create more pro-health laws in advancing children's health and welfare, to be champions for stronger regulations on sales and promotion of these products, higher taxes for these to keep these products away from the hands of our children. And this we should be kept in our minds, that the people we will choose to elect, that we need effective laws on these hazardous products, the yosi, vape at alak. Noon pa man sinasabi natin ang kabataan ang pag-asa ng bayan. Sila ay di dapat pabayaan, dapat nating protektahan. And there is no better time to advance people's right to health and put public health in the forefront of issues than today, and that's now. Let's end this epidemic now. Please save our children, save our future.
Maraming salamat, Doc Riz Gonzalez ng Philippine Pediatric Society. Kailangan natin tuldukan itong epidemic among young people sa yosi, vape at alak. At isa doon, isang paraan ay mga health laws at yung health taxes on yosi, vape at alak. Ngayon naman mula sa Philippine Academy of Pediatric Pulmonologists, palakpakan natin Dr. Cory Avancenia.
Good morning, sir. Thank you, Dr. Hector. So, paano natin nasasabi na ang tinatarget ng vape industry, kabataan? Di ba, may vape clouds, nakakaaliw, may flavors, masarap, matamis, mabango. Okay, so that's why we're saying kabataan talaga ang target nila. So, ayon sa pagsusuri ng Syntax Coalition, as mentioned by AJ earlier, noong 2021, there was 37,513 vapers na umakyat noong 2023 to 423,185. So imagine lumobo to ng 1,100%. Dapat na nakakabahala yon, di ba? And ayon sa Global Youth Tobacco Survey, 1 out of 7 Filipino children, 13 to 15 years old, ay gumagamit na ng vape. So nakaka-shock. So that's why it is an epidemic and it is an emergency. And then nakumpara pa to ng another study comparing those who vape, those who started to vape, at those na nag-enroll sa DepEd na alternative learning system. Nakakagulat, mas maraming nag-start mag-vape kesa dun sa nag-enroll sa DepEd. So what does this mean? Mas nakukuha ng vape industry ang kabataan kesa ng DepEd. And we have to invest on our children. They're our future, as Dr. Riz mentioned earlier. So we really have to invest on our children. So, syempre, education, DepEd. And then, na-mention earlier din na nagkaroon na tayo ng EVALI, yung E-Cigarette Vaping Associated Lung Injury sa Pilipinas. Dati nababasa lang natin yun. Ngayon nasa Pilipinas na siya. So yung unang nakita was in Cebu for a 16-year-old. Then last year, meron na tayo 22 years old na namatay sa PGH. And walang duda, he never smoked, he never had COVID, pero nag-e-cigarette siya ng 2 taon. And for you to classify it as EVALI, a minimum of 3 months of vaping straight. So, as mentioned then earlier by Dr. Hector, kami mga doktor, ginagamot lang namin sila, but more than educating our patients, more than treating our patients, gusto natin prevention. So, we want turuan natin sila. And we can only do so much. Patient per patient, family per family. Siyempre, gusto natin mas pangkalahatan. So, that's why we want laws, and we want na hindi lang enough na may laws. Dapat may talaga, tarang may tututok dun sa batas. And ang turo namin sa mga bata sa Philippine Academy of Pediatric Pulmonologists is not one puff ever. So wag sumubok. And ang mga bata, they're price sensitive. Siyempre yung baon nila, titipirin nila, magdadalawang isip sila bumili kung mahal yung produkto. So not one puff ever, and that goes for any bisyo. Be it yosi, vape, or alcohol. So, sana itong panawagan namin pakinggan so we can have all these laws that will help our Filipino children. Salamat.
Maraming salamat, Doc Cory Avancenia mula sa Philippine Academy of Pediatric Pulmonologists. Ang mura kasi, di ba, ng yosi, vape, at alak. So we need to impose taxes and other health laws to keep away our children and young people from these. Ngayon naman ay mula sa perspective ng isang magulang. I think a sector that is quite concerned about this youth epidemic on yosi, vape, at alak. Palakpakan natin mula sa Parents Against Vape, Ms. Reby Relator.
Kung susundan natin ang data ng Action for Economic Reforms na binanggit ng mga naunang nagsalita, sa loob ng 2 taon, dumoble ang tala ng mga kabataang umiinom ng alak at naninigarilyo. Pero nakaka-alarma na ang vape ay lumobo ng 1,100% sa parehong panahon. Nagkakaroon na ng vape-demic ang Pilipinas. Apektado ang mga bata at kabataan sa second-hand smoking. Ngayon, dumagdag pa ang second-hand aerosol due to vaping. Samantala, may mga leader na isinusulong ang pagbaba ng buwis sa yosi, vape at alak. Ginagawa ng panukalang batas na ito na mas magiging accessible ang sigarilyo at vape sa ating mga kabataan na siya namang magdadagdag ng higit sa 1 milyong smokers kada taon. Walang magulang na gugustuhing makita ang kanyang anak na malulong sa kahit anong bisyo. Papayag ba tayo na maging mas accessible ang bisyo kaysa sa serbisyong pangkalusugan? Kaya nanawagan ako sa lahat ng mga magulang na piliin nating mabuti ang kandidatong ating iboboto. Kailangan natin ng mga leader at mga mambabatas na nagbibigay prioridad sa kalusugan ng mamamayang Pilipino, lalo na ang kapakanan ng ating kabataan. Kailangan natin ng mga leader at kandidatong maninindigan at magsusulong ng panukalang batas para itaas ang buwis sa yosi, vape at alak. Nananawagan ako sa ating mga kandidato ngayong umaga bilang isang ina, huwag kayong magpadala sa industriya ng vape, yosi at alak. Huwag niyong itaya ang buhay at kinabukasan ng kabataan. Piliin niyo ang mamamayang Pilipino kaysa sa bilyones ng mga industriyang pahamak lamang ang dala. Sa darating na election sa Mayo, pumili tayo ng kandidatong pro-health at kayang ipaglaban ang malinis na kapaligiran at malusog na taong bayan.
Maraming salamat, Ms. Revy. So mula sa perspektibo ng ating mga magulang. Ngayon naman ay mula sa Philippine Society of Public Health Physicians. Palakpakan natin Dr. RJ Nagit.
Magandang umaga po. Kami po sa Philippine Society of Public Health Physicians ay nakikiisa sa mga health advocates, sa mga kasama ko pong doktor dito sa ating panel sa pagdeklara ng epidemya sa yosi, vape, alak at pagsulong ng mga health tax policies at pagkondena sa House Bill 11360 o ang Sin Tax Sabotage Bill. The Philippine Society of Public Health Physicians supports the use of health taxes as a sound tobacco control policy. We are committed to strengthening universal health care to improve the lives of all Filipinos, especially to the most vulnerable sectors and communities. PSPHP also supports the Philippines' participation in the international commitments for health, such as the WHO Framework Convention on Tobacco Control, or WHO FCTC. Since its signing in June 2005, we have made important gains. Marami na tayong napanalo dito sa ating laban para sa tobacco control. We have reduced smoking in adults and adolescents and enacted a sin tax policy that has been considered as a global success and a model for effective tobacco control. In fact, in 2015, we have been awarded by the Bloomberg Philanthropies for our efforts on tobacco control. However, our successes in tobacco control are hampered by suboptimal policy and have been threatened by weak implementation of our laws. And of course, the continued interference of the tobacco and nicotine industry in our policy making. After years of seeing a reduction in tobacco use, we are now seeing an increase once again in our youth sector as more young people take up vaping or the use of e-cigarettes and heated tobacco products. Despite the known harms of vapes and e-cigarettes, companies continue to market and sell them as appealing, preying on our youth. Habang kumikita yung industriya, our youth and children suffer as their parents shoulder the cost of a preventable condition. The efforts of the healthcare sector, the educational sector, and our communities to protect youth are being undermined by how the tobacco and vape industry targets our young people by increasing access and appeal of these devices. Arguments on personal responsibility and discipline are a myth when you have these industries engineering this false need among young people. Taxing yosi, vape, at alak to reduce their affordability is an evidence-based means of making all tobacco products and vapes less accessible to the public, especially to our youth. Thus, the PSPHP strongly condemns House Bill 11360, which undermines and rolls back gains from our sin tax law by proposing a reduction in the annual 5% tax increases. This bill, if enacted into law, would harm the health of the Filipinos in two ways. First, the legislation would continue to make cigarettes, vape, and other tobacco products more accessible to the youth. This would result in nearly 1 million new users of these products over the next 10 years. This will mean more cases of lung disease, cancer, and other non-communicable diseases linked to tobacco use. And in addition, it will also add burden to our already overstretched health system. Second, the resulting reduction in sin tax revenue would further limit the financing and resources for universal health care, limiting our health system's capacity to serve the most underserved of the Filipinos. We support the continued taxation of all tobacco products such as cigarettes, and cigars, tobacco products, including vape and heated tobacco. And this also includes alcohol products as part of promoting the health and wellness of Filipino people. PSPHP calls on our legislators, currently in both houses of Congress, the Senate and the House of Representatives, as well as those running for office in the 2025 elections, to take a pro-people and pro-health stance during this campaign season by supporting our health manifesto. We call on our leaders to reject and expose all forms of tobacco, vape, and alcohol industry interference, including programs and initiatives that present themselves as tobacco harm reduction or corporate social responsibility. If our representatives and candidates truly care for our people, kung may malasakit talaga sila sa ating taong bayan, they should stop any attempts to reverse the Filipinos' gains in protecting their health. We are in solidarity with the health advocates, medical societies, parent groups, and the rest of civil society in demanding commitment from our candidates and in working for a tobacco-free Philippines for this election and beyond. Thank you.
Maraming salamat, Dr. RJ Nagit ng Philippine Society of Public Health Physicians. O ayan, nanggaling na sa ating mga doktor at mga health advocates na malaking pahamak ang yosi, vape at alak. No? So there's no debate about it. There is an ongoing epidemic among young people na on yosi, vape, and alcohol consumption, and we need to address it. One effective measure is imposing taxes on these products to save young people, to save public health and the Filipino people. We also call on our electoral candidates to take a stand on this issue. Maraming salamat sa ating mga RPs. Palakpakan po natin sila. I would like to, for photo op, before we go to an open forum, I'm sure marami tayong mga tanong. I would like to first ask our resource persons to show our manifesto here. At pwede rin nating, I would like to also ask if anyone wants to do a photo op with our resource persons mula sa print, digital, and even sa TV. Ito ang Syntax Coalition Manifesto for a Healthier Philippines Towards Safer Communities and Stronger Health Systems, a call to action on health taxes. Wait lang daw, pati TV daw. Okay. After po, okay na yung print? Okay. TV naman. Pwede ba sabay-sabay? Malaking pahamak ang yosi, vape at alak. Okay? So malaking pahamak ang yosi, vape at alak. 3, 2, 1. Malaking pahamak ang yosi, vape at alak. Isa pa po, like we mean it. Oo. Joke lang. Ready, we really mean it. Malaking pahamak ang yosi, vape at alak. 3, 2, 1. Maraming salamat sa ating mga resource persons. Meron pa po tayo. I would like to call on our health advocates and coalition members on stage para i-sound ang alarm. So our doctors and health advocates are sounding the alarm on the youth epidemic on yosi, vape at alak. I would like to ask na nandyan yung ating manifesto, si Doc Hector Santos ng Philippine Medical Association is literally sounding the alarm on the youth epidemic on yosi, vape, at alak. Anytime you're ready, Doc. Isa pa po na merong malaking pahamak ang yosi, vape at alak na sabay-sabay. Sound the alarm, Doc. 3, 2, 1. Isa pa po, Sound the alarm, Doc. 3, 2, go. Okay na? Okay, maraming salamat po sa ating mga health advocates. You may now take your seats. We are now ready to answer questions from members of the media. Meron lang po kaming pakiusap. I know that we have a lot of issues going around right now. And you can take some of our resource persons on the side for a side or one-on-one interview. We would like to have the questions on the issue at hand. No? Okay. Justin will be the one who wants to go first. Joey Marzan, Daily Guardian. Go ahead.
Hi, good morning. My name is Joey Marzan from Daily Guardian. I just wanted to ask, aside from raising taxes, what are other interventions that you may suggest? Kasi what we're seeing here is that even if we raised sin taxes back then, parang tumaas pa rin eh, if we've seen the survey. So who's to say na even if we raise, hypothetically, if we raise taxes now, who's to say na hindi pa rin siya, that they will not find ways to make it more accessible? So what are other interventions that you may suggest? Kahit sino na lang, hindi ko alam kung sinong pwede makasagot.
Sure. I'll hand it over to AJ Montesa, Action for Economic Reforms.
Yes, thank you so much for the question. No? I think it's important to establish that taxes have actually been the most effective way to reduce consumption. We pointed out data from 2023, but from 2009 to 2021, malaki yung naging reduction ng consumption ng cigarettes and other tobacco products as a result of the tax increases. So before the pandemic, taxes were highly effective. So it begs the question, bakit biglang nagkaroon ng increase? No? One thing that we have to point out is the vape law na tinatawag. They call it the vape vape regulation law. But in fact, we should treat it as more of a vape liberalization law. Because what they did was they made vapes more accessible. They made it easier for people to address now, and they took away the regulatory powers from the FDA and gave it to the DTI, which doesn't really have a health thrust. No? So what we're saying is tumaas yung prevalence ng smoking because vapes have become more popular. Na-point out po ito ng Parents Against Vape, 1,000% yung pagtaas ng pagbe-vape. No? For alcohol naman, we do have taxes, we do have regulations, but we know for a fact na hindi ito strictly enforced. So what do we need to do? We need to have stricter regulations also. Taxes are the most effective policy, but regulations can also complement itong taxes na ito. Keep it out of reach from young people, make it inaccessible to young people, and stop yung aggressive marketing, lalo na sa vapes na may colorful packaging, may flavors. Sa alcohol, may tinatawag na alcopops na pina-flavor yung alcohol na matatamis, no? That's what gets young people to try it at first, and then, kagaya ng sinabi ni Doc Chris, nahuhook sila, and eventually over time, nag-develop yun. So I think yun yung kailangan tutukan po ng gobyerno natin.
Other questions? Thank you. Sorry, asan si... Ayun, Doc Chris Gonzalez also.
I would like to add, ang Pilipinas kasi isa sa signatory ng WHO FCTC. At hindi dapat nating kalimutan yung effective strategy na noon pa man lahat ng bansa nag-work, no? Yun yung tinatawag nating empower. So kaya may survey kasi dyan yung monitoring ng tobacco use at saka prevention policies. P is protect the people from tobacco smoke. Yan yung mga warnings, yan yung mga graphic health warnings. Sad to say, kulang pa ang ating graphic health warnings dito sa Pilipinas. Kalahati pa lang ng pakete. At included dapat doon ang vape, no, doon sa graphic health warning. Kaya pag nakakita kayo ng vape na walang graphic health warning, violation na po yon sa existing law natin. Offer help, no, yung tobacco quit line, underutilized eh. Pero naandyan, madaling makontak and they are willing to help until the adult or the young user is able to quit. Yung warning, no, ng dangers of tobacco, yan yung graphic health warning. Tapos yung mga tobacco advertising, dapat may restriction. Wala tayo dapat nakikita mga tarpaulin ng mga sigarilyo o vape all around. At lalo na, pinaka-effective yung R, raising taxes on tobacco. At masasabi ko sa inyo, kasi ako po ay isang daughter ng chronic smoker, Nung pumunta si tatay sa Amerika, nagulat siya, napakamahal. Yun ang isa sa step niya ng cessation kasi ang mahal, hindi niya mabili. So unti-unti na-challenge siya. Kaya yung pagtaas ng tax, napaka-effective po yan. So these are all evidence-based through the WHO FCTC at yun po ay hindi dapat nating kalimutan.
Maraming salamat, Doc Chris. So raising taxes is the most effective control measure. Yes? Pakilala lang po. Oh, sorry. Hindi naka-on daw. It's okay. What's the question? Ito na lang.
Hello, so related po siguro dun sa naunang tanong kanina. Paano makatutulong ang pagtaas ng buwis sa alak para mabawasan ng mga aksidenteng related sa alcohol? And then for a follow-up question po, since it's National Women's Month, pwede po ba natin i-reiterate kung paano nakakapag-aggravate ng domestic abuse and violence ang alcohol? Salamat po.
Okay, anyone? Doc RJ, perhaps? And AJ, okay.
Sure. Very good question po, no. As na-mention na po, no, taxes are highly effective because pag tinataas po natin yung presyo, law of supply and demand po yan. Pag tumataas ang presyo, bababa yung konsumo ng mga tao, no. Surprising to know po, little known fact, the Philippines has some of the cheapest prices of alcohol in the world. So kahit sinabi pa natin nagkaroon tayo ng alcohol tax, pinakamura pa rin yung presyo ng alak natin. In fact, mas mura pa yung isang bote ng gin kaysa sa isang fast food na value meal. So it's too accessible to too many people. And yung alcohol, cause talaga siya ng road accidents because even if hindi ka intoxicated or if hindi ka lasing, makainom ka lang ng kaunti, it can impair your cognitive ability, your driving ability. Kaya may tinatawag na term na driving under the influence. It doesn't mean na hindi ka drunk ay makaka-cause ka ng road crash, no? It means that at any level of consumption of alcohol, there is an impairment to your ability. So in fact, around 20 to 25% ng road accidents in the Philippines are attributable to alcohol consumption. Nasa 1,000 deaths yun per year ay dahil sa drink driving or driving under the influence of alcohol. Maganda yung tanong about women. This National Women's Month, we have to acknowledge that alcohol is also a risk factor for domestic violence. May surveys na ginagawa. Ang lumalabas ay women who have domestic partners who drink alcohol are 2 to 5 times more likely to experience some sort of intimate partner violence. No? So these are all data that indicate that you don't have to be the consumer of alcohol to feel the harm. No? Hindi lang sakit sa atay, hindi lang sakit sa katawan, kundi yung mga social harms ay kasama dito, road crashes, vehicular crashes, domestic violence are all part of the harms of alcohol. And as we mentioned, yung pagbubuwis o yung pagtataas ng tax po is an effective way dahil masyado pang mura ang presyo ng alak dito sa Pilipinas.
Okay, thank you. So yung pahamak ng alak ay hindi lang physiological, no? Meron ding social harms. And then parang yung misconception na kailangan lasing ka in order to be a threat on the road, hindi. Kahit kapag uminom ka lang, that also already poses a risk. Kaya siya drink driving or driving under the influence. And isa pa sa social harms nga, yung incidents ng domestic violence. Okay, thank you. Other questions?
Hello. Hi, I'm Alan Limos from the Manila Times. Now, I would like to ask, because according to the National Institute of Health, psychiatric problems lead to alcohol and tobacco use. Now, when it comes to addressing the mental health concerns, right, at its very core, what are your plans on mitigating that, aside from, of course, imposing taxes?
Okay, Doc RJ.
Ayan, actually isa yan sa mga concerns, no? Kasi parang ano yan, parang cycle siya, no? Pwedeng maging contributor, pwede rin siyang maging effect, no? Kasi we also know that yung addiction is also, or substance use or dependence to these kinds of products, no? Correlated siya with some mental health considerations. So I think yung approach naman to our clients is that it's always holistic, no? But at the same time, we also recognize na lahat ng behaviors natin merong risk na katumbas. So for example, yung paggamit ng alcohol, tobacco, o kaya yung vape, meron silang karapatang risk. The more you use, the higher the risk. No? So yung sinasabi natin dito is that yung sin taxes, isa siya sa mga pinaka-effective na paraan para mapababa yung accessibility ng mga ganun, lalo na sa ating mga kabataan. Actually, kaya nga i-relate ko dito sa ating panawagan na it's actually considered now as an epidemic. Kasi ngayon, nakita natin na dumoble, no, yung mga paggamit dito sa kabataan. Actually, dito sa smoking pa lang, tumaas siya from 2.3% in 2021 to 4.8% in 2023. So sa Yossi pa lang yon, no? Pero sa vape naman, nag-increase yung smoking ng vape, no? To 5-fold times, no? So from 7.5% in 2021 to 39.9%, no? Tapos sa alcohol naman, 4.9% in 2021 to 10% in 2023. So kung titignan mo, Yossi, vape at alak, tumaas siya, no, among the youth sector. Kaya nga, especially now na yung mental health concern, isa rin sa mga ina-address natin sa mga kabataan ngayon, kailangan twin yung approach natin, no? And of course, we recognize that yung sin taxes or health taxes, isa tong paraan to also protect the mental health of our young people.
Thank you so much. So raising taxes is a way to protect young people's mental health. Next po.
Good morning po. Pian Manalo po from PTV4. Sir, how can the government and the health organizations work together to implement effective regulations and education campaigns?
Paulit po, sorry.
Okay. How can the government and health organizations work together to implement effective regulations and education campaigns?
Yeah, may I answer? The Philippine Pediatric Society, we were once called the Tobacco Control Advocacy Group. We are always called during the legislative process in the Senate and in the Congress to present evidence, no, studies and all, why we are pushing for restriction of flavors, raising the age of access, those graphic health warnings, presenting them the data here and those we gather abroad. So kami yung naglalobby sa Senate and sa Congress for effective laws. So when we are called, we make it sure any one of us in the committee is there. And GB, may I introduce and segue dun sa first question, may I add? Actually, sa committee namin, so we recognize the problem. Therefore, we need to have solution. We have actually an addiction medicine specialist with us, Dr. Paul Filomeno. You may be aware, and I would like you to be aware, because those who are dependent, nicotine dependent, or there is alcohol dependence, we can always ask for a specialist, no? So meron pong solusyon. So may I call my colleague, Dr. Paul, to shed light on the science of addiction medicine.
Okay, Doc Paul. Can we hand the microphone to Doc Paul?
And so, hello.
Ayan, okay.
Hello. Ayan, so, ayan po, I'm Paul Filomeno. I practice addiction and recovery medicine. So, as part of the PPS Committee on Tobacco and Vape Control, so we recognize kasi, di ba, Yossi, vape, and alak are, hindi natin sila tinitingnan usually as, or we see them as something like commodities or something that we purchase. But in the lens of addiction, we see them as psychoactive substances. So we all know that as substances that can actually affect the brain. no, alongside with the benefit that they have. For example, if alcohol relaxes a person, the collateral effect of that is triggering addiction. And there's a false narrative that people seem to have this perception that engaging in a very addictive substance as nicotine and alcohol, that they can control it. No, a lot of people begins with a benign narrative that okay, I can manage to control it. Then eventually, as what most of our patients would say, Doc, I'm in a very dark place, and I'm in a very lonely place right now. And so that is how addiction sets in. When a person continues using it despite negative consequences in their lives, may it be relational or even health-related effects already, that is addiction. And addiction, when it sets in a person, is difficult to treat. You need a lot of interventions, you need rehabilitation, and economically, it will cost an individual a lot of money, the family a lot of money, and even the community. So translating that even in the economic effects when addiction sets in, it's very harmful, not only for the family, but also for the society.
Thank you. Doc RJ, yes.
Ayan, siguro of course I support yung position po ni Doc Paul in terms of addiction and of course dependence on nicotine, alcohol and vape, no. But also I would like to emphasize na sa public health po, we also emphasize yung importance of recognizing yung commercial determinants of health, no. And alam natin dito sa usapin ng nicotine, vape at alak, malaking player dito yung industriya, no. Ginagawa nila na aggressive yung marketing, lalo na sa mga kabataan. Kanina na-mention po yung ginagawang dinagdagan yung mga flavors, no? Pinapaganda yung disenyo ng mga produktong ito at nagiging accessible siya, no, to young people. Sabi nga ni Doc Riz kanina, 24/7 na halos no, yung mga vape shops natin ngayon. So there has to be some accountability, no, sa ating mga industry players because after all, sila yung kumikita dito at the expense of the Filipino youth, no? So we have to double down on that.
Thank you, Doc RJ. So I'd like to go back din kanina sa premise, no, na every use is risky and we need to be able to address the use of Yossi, vape at alak, and one effective measure is really raising taxes. Very quickly, Doc Cory, and then we go to ABS-CBN.
I remember your question was yung I remember you were saying something about like the government and the private sector. So, kasi kami sa Philippine Pediatric Society at sa PAPP, nagle-lecture kami sa, in fact, pre-COVID, we partnered with schools. Pero we realized, even after doing that, bakit pa rin tumaas? So we were surprised between 2021 and 2023. And that's COVID times. Mga tao nasa bahay lang nila. Bakit ito tumaas? So even if we tried to do our part as private citizens, going from school to school, it didn't work. And ngayon, we also partnered with DepEd already. So that's the nice thing. It's a very positive thing that we are partnering with government, which is DepEd, and our society and PAPP, and there is actually already a MOA. So hopefully, this will help, but what will really help if meron talagang law that will be strictly enforced. Kasi dati naman meron na eh. Ang naging problema, hindi na strictly enforced. And what's worse was, hindi na nga strictly na enforced, gumawa pa ng bagong law, which was the vape law, na instead of strengthening the law, they weakened the law. So, to me, that's so sad, and that's why you're very right, we have to partner with government and maybe not just enough na one Shanghai ng government, lalim Shanghai ng government. It has to be a law that will be strictly enforced. So the lower the tax increase of yosi, vape, and alcohol talaga ang importante.
To ABS-CBN. Thank you.
Good morning. Rafael Bosano po from ABS-CBN. I actually have two questions, so is it okay to shoot both of them? The first question is, among the candidates po seeking a seat in the Senate or in the House, do you really see anyone who will really be an ally and really push for the reduction in terms of access to vapes, cigarettes, and alcohol? At may nakausap na po ba kayo sa kanila? And to give you their assurance that they will really lobby for this?
Sige, that's a very good question. Lalo na't election, relevant po ito, no? We want you to know that we will give you a copy of the manifesto, and our plan is really to approach individually yung mga nangangandidato, including the senators na tumatakbo, including the district and party list representatives, para makilatis natin kung sino talaga yung pro-health, no? As of now, this is the launch of the campaign, and we will make sure that we will let the public know who are our pro-health advocates. But can I name the members who were very supportive of our health campaign in the last Congress, no? So I would name Senator Pia Cayetano, who was very instrumental in having hearings on the issues of vapes and cigarette consumption among the youth. No? She had hearings just a couple of weeks back, and she really drove that point home. And we hope that she will continue to be a strong advocate for this initiative. I don't think the doctors are going to speak on behalf of their institutions, but I wanted to acknowledge these people kasi. And si Congressman Ray Reyes also of the Anak Kalusugan Party List, who in the past few months also called for higher taxes on alcohol. No? And to tie it back to the conversation that we've been having, mahalagang punto po talaga yung industrial interference. No? Natanong kanina, ano ba yung pwedeng partnership ng government and ng medical groups and advocates, no? These people have been trying to talk to the government for so long. Si Doc Hector from the PMA is so gracious to host us here, pediatric physicians, public health doctors. They're making this effort to talk to the government and to talk to the public. Pero sa totoo lang, ngayong eleksyon, marami ang kandidato na mas makikinig pa sa industriya, mas makikinig sila sa pera ng tobacco industry or ng alcohol industry. So we hope that we are calling attention to the health of the Filipinos, to this epidemic, and we are calling on the attention of our candidates. I-prioritize po natin ang health ng taong bayan, i-prioritize natin ang health ng mga Pilipino, ang public health, over the industry's interests in tobacco, vape, and alcohol.
Thank you. Doc Riz wants to add something.
May I add, I think last week, nakita ko yung SWS survey, how the Filipinos will vote for their elected candidates. Topmost, food security, agriculture, basic need. Second, health, basic need. So ito yung aming ding oportunidad to call. Let's raise pro-health taxes. Kasi yun ang kailangan ng tao. Lalo na ang mga kabataan na walang boses, hindi pa makakaboto, pero sila ang magmamana ng maling kamalian na gagawin natin. Kawawa naman sila. Meron ng harm, hindi pa natin inaksyonan. Ang inihingi lang naman namin ay batas para protektahan ang ating mga kabataan laban sa yosi, vape at alak.
Thank you, Doc Riz. Thank you, AJ. Ang bilis kasi or ang dali magsabi yung kandidato na pro-health sila, di ba? Pero magbigay ka ng specific instance. Are you in favor of raising health taxes, no, to curb the youth epidemic? Additional? Yes po.
Yes po. On the part naman of medical societies, do you also have plans to make cessation programs more accessible to the public? Because some are saying that they really want to quit smoking, they want to quit vaping and drinking, but the problem is they don't know where to go or who to talk to.
Yes, Doc Riz.
Na-mention ko na yun, ano? Actually, meron tayo sa DOH quit line. Underutilized eh. Sa NCR, libre yun eh. Text 1665. Dun sa regional, pwede ka ding mag-connect doon. And mind you, they will help you all the way the steps if a follow-up ka pa. Hindi lang nahahype ng media, meron. Sa mga kabataan, ibang usapan. Kaya nga yung PPS, no, yung tobacco control, ni-name namin PPS Committee on Tobacco and Nicotine Control and Cessation. At kaya ako inintroduce kasi kanina yung addiction medicines kasi this is one science na kailangan nating maintindihan. So meron tayong Philippine Society of Addiction Medicine. Si Dr. Paul kasama namin sa committee and right now, kami po ay naglilibot sa bawat chapter ng aming Philippine Pediatric Society, again creating vape and smoking harm awareness and offering the steps in cessation. It's a hard step kasi lalo na ang vape bago, maraming variabilities. But unless, not unless we took that step, we are taking bold steps because there is only one goal, to remove all the children from these harmful substances. So we're doing the health aspect. We're calling on the government to help for regulation. Kasi ang mahirap, alam mo, laging tinatanong ng mga bata, you're here, you're telling us it's harmful and all. But what is the government doing to protect us children? That has always been a strong question. Ang hirap nilang maintindihan. Bawal pero nakikita. Bawal kaso mura. Bawal kaso meron ng paglabag sa batas pero andyan lang. They are now turning numb. Parang kami bilang health advocates, parang nakikita namin kung anong nakikita ng bata akala tama. Napakahirap. Ganon din pagka naka-encounter ng isang may nicotine dependent, yung pleasures na nakukuha nila, tapos sasabihin mo ganito, pag naramdaman nila yung mga withdrawal symptoms, ang hirap pabalik-balik. Meron ngang term dyan, di ba? It is easier to raise stronger children than to repair a broken man. And these substances, Yossi, vape, and alak, will definitely create broken man, which is so hard, very hard to repair, and it might create lasting impacts into their heart, into their brain, to their psyche, and into their family.
Thank you, Doc Riz. More questions? Yes.
Hi, Doc. Good morning po. Gerard po from Malaya. Isang question lang po. With regards dun sa election pa rin po, nabanggit na rin po kanina. On the flip side, are you going to campaign against candidates who will not choose to battle this epidemic po? Thank you.
Thank you. Yes, AJ.
I think we will campaign against candidates who are pro-tobacco and pro-alcohol. No? Yung mga nagsusulong ng syntax sabotage bill, yung mga nag-file po ng batas na iyon na gustong ipababa po yung buwis sa tobacco, sa vape, sila po yung kalaban natin sa public health po. So, and I think they don't deserve our votes. They don't deserve our support. No? But we will make the effort na kausapin as many candidates as possible na suportahan at isulong ang pagtaas ng buwis sa Yossi, vape at alak.
Ayun. Thank you, AJ. Other questions? Okay. Yes po, sir.
Yes, good morning. Dano Tingkoko from GMA 7. Just to ask, kasi one of the things na laging binabanggit is stronger, yung sa manifesto or what you want the government to do is stricter implementation of laws because you're seeing there are several loopholes, even calling the vape law, the new vape law, a weaker law, and yung sin taxes and other laws na napasa na may mga loopholes sa implementation. And also, one of the things na nabanggit kanina is how merong existing na sin tax sabotage bill. And in light of the sin taxes being implemented, yung context na yon, may data din na showing a great increase in the users of vapes and cigarettes. Yung alcohol parang hindi yata na-specify yung specific numbers. Yung taxes ba, na yung sin taxes, if you follow those tranches, at this point, does it still work? And exactly, siguro like anyone can answer this, That's one question. And number two, when you say stricter implementation, this also goes for candidates na mananalo sa election and they'll be taking over. What exactly do you want them to do other than the catchphrase na you should espouse policies on limiting access to these vices sa mga bata? Like, exactly how do you want them to do that? Kasi that was the intention of the vape law.
Thank you. Maybe we have a clarification on the vape law first, and then the tax measures and how it helps. Sige, thank you. AJ, and then Doc Riz perhaps after, no?
Sure. Regarding the vape law, again, one of the main features of the vape law that increased access to vapes was the regulatory powers. No? In the past, it was the FDA, the Food and Drug Administration, that exercised regulation over this because sila ay mayroong health expertise at technical expertise pagdating sa vapes. Now, it is with the DTI. No? And ang main thrust talaga ng DTI is to promote the industry. So there's a mismatch on what is the main objective of giving them the regulatory powers. Pangalawa, there are many things lacking in the vape law. Prior to the vape law's passage, the prior tax laws made the age of restriction up to 21 years old. Ang ginawa ng vape law ay ginawa siyang 18 years old. There were proposals before na dapat ang regulation limited yung flavors ng vapes. Halimbawa, dapat menthol or tobacco flavored lang siya. Because we understand that the flavors, yung mga sweet, yung mga candy, or yung mga fruit-flavored products, that's one way to market it towards the youth, no? And yung vape law essentially allowed that. It allowed the flourishing of the vape industry. Kagaya ng sinabi nga ni Doc Riz, in fact, may mga 24/7 ka na vape, may mga vape lounges ka sa loob ng mall. All of these, the fact that these exist, shows na hindi gumagana yung vape law natin to regulate it properly. If we want to have a proper vape regulation, kailangan ma-address lahat ng issues na iyon. Okay, so I think Doc Riz can add to that. I'll just go to the tax issues first. No, na-mention yung taxes. Is it really working? No, we think it's still working, but the question is, are people still following it? Especially the industry. We deserve to ask the tobacco industry if they are paying the right taxes. Kasi alam natin na there was a case before, I think it was in 2017, 2018, it was the Mighty Corporation, nalaman na sila mismo yung hindi nagbabayad ng tamang buwis. No? What did the government do at the time? Bumaba yung revenue ng year na iyon. Ginawa ba ng gobyerno na babaan yung tax? Hindi, di ba? Ang ginawa ng gobyerno ay hinabol nila yung Mighty Corporation at magbayad dapat sila ng tamang tax. So that is the approach that government should take. Dapat yung administration na ito should be harder on the tobacco industry, on the alcohol industry, kasi they will make that argument. Sasabihin nila na hindi na gumagana yung tax, kailangan yung babaan yung tax namin. That's only favorable to them, to the industry. Lalaki lang yung kita nila, babawasan yung kita ng gobyerno, at bababa yung presyo ng sigarilyo, kaya dadami yung maninigarilyo at iinom ng alak. No? So that's the main point.
Go ahead.
So if you're saying, diba, so you think the taxes still work, pero the question is, are the people still following it, like yung industry players and the manufacturers? But these taxes are still ongoing and merong tranches to be followed. Ito nga yung gustong baguhin ng sin tax sabotage bill. Saan sa tingin ninyo sumabit?
So it's a broad problem na kailangan the whole of government has to approach this. No? Malaki ang role na gagampanan ng Department of Finance. No? Si Secretary Ralph Recto has a lot to answer for as regards this. No? Yung BIR, yung BOC, yung customs natin ay kailangan ma-address yung issues na ito when it comes to yung hindi pagbabayad ng tamang buwis pagdating sa sigarilyo. No? And at the same time, kailangan sila din yung manguna sa pagkukol ng mas mataas pa na buwis. No? So I think it was kind of telling na during the discussions on the sin tax sabotage bill, tahimik po yung Finance Secretary ng panahong yun. No? So I think that's something that we have to flag na kailangan ma-call yung attention ni Secretary. Again, in the past administration, the Finance Secretary was very strong in calling the tobacco industry, yung Mighty Corporation, na magbayad ng tamang buwis at nasingil nila yon. Why can't our Finance Secretary now do the same thing for the current tobacco companies? No? Why are they not making a strong stance against illicit trade like this?
Doc Riz.
Iba yung pananaw ko dito ha, bilang doktor. ang lagi nating gusto sa pasyente to go back to optimum health. Ganon din naman ang tobacco laws, no? Kung i-review mo, so parang sa doktor din, lagi kami nagre-review ng history, bakit ka dumating sa ganitong punto. Yung Tobacco Control Act of 2004, it is a call during the Clean Air Act. Kasi we want clean air. Kasi masamang hangin, magdadala na maraming sakit. Tuwasok din ang WHO FCTC in 2012, nag-sign ang Pilipinas kasi ang taas ng ating use and ang taas din ng second-hand smoker. Marami ang namamatay na Pilipino, gawa ng paggamit at exposure. Effective, no? From 40, bumaba. Nung taong 2019, parang nagpa-plateau. Parang walang nangyayari. Kaya noong 2019, itinaas pa ulit ang taxation ng cigarette. Kasi nga, the higher it goes, ang premise is hindi mabibili. Para ring bakuna Kaya meron mga booster shots para itaas ang proteksyon. Ganon din yung nangyari noong 2019. Nung panahon na yon, yung e-cigarette, parang the kid on the next block lang yan. Pero nandun na yung threat and we sounded the call already. Hindi namin pwedeng isabay ang law ng tobacco against e-cigarette kasi sinasabi ng industriya, hindi naman tobacco product yan. Pero may nikotina pa rin. So iba ang naging So kaka-attend namin, lumabas yung RA 11467. That is actually months before the pandemic. Tuwang-tuwa kami kasi nasabihan, na-convince namin ng legislator yung science. We're always presenting evidence by science. Kasi dati ang ating age of maturity, 18. We told them the brain matures later, 25. So ginaya lang natin ang other countries na 21 kasi sila yung huling nagmamature. Kasi kung 21 o 25, yung dependence nila hindi ganong kasing sama kung younger. Tapos mas madali mo silang masisway for cessation. Tapos nakita din sa pag-aaral, yung flavors ang number 1 na nag-a-attract. The children are experimenting. Sabi siya, it is attractive. It is available. It is accessible. Kaya yung count. Dumating ang pandemya. Yung gains ng 11467 na sana makikita natin after 6 months or so for implementation, na-silence ang medical community. We were busy with our COVID patients and health issues. Kaso ayan na yung RA 11900 na nire-reverse ang gain. Kasi nga, out of the lobbying of the industry. Ibig sabihin ba ang vape mas masama kaysa sa sigarilyo? Kaya tinataas yun ng 21. Ang contention namin, we have to start somewhere. And if we have raised it to 21, the cigarettes, the alcohol will also be raised to 21 based on that science evidence that the age matures at 21 and up because we want to protect our children from the harms. Tapos, tayo lang ang bansa dun sa vape law na ang DTI ang nag-regulate. Department of Trade and Industry, Commerce, consumable. This is a health product. Pero, yung DTI is in consultation with FDA. Very good, no? Kaso, noon, yung online access pwede. Buti na lang, sinabi nila, bawal na yung online access sa mga yung mga popular. Kaso nga, sa social media and other ports, i-type nyo, nandun. They have their ways of really circumventing the taxes. Tapos, bumaba, kasi nandyan na ang disposable vapes. It's flooding the market. Hindi rin siya makategorize sa law kasi kung ang vape, iba-iba ang milligrams ng nicotine hindi kagaya sa cigarette. Isang pack, 24 milligrams. Aba, alam nyo ba na ang vape law inaalaw 65 milligrams? Pwede. Alam nyo ba na ang toxicity level ng nicotine enough to poison you is 65 milligrams? We need to correct that. Sino ba maaapektuhan? The young. Graphic health warning. Sa sigarilyo, pag bumili ng tingi-tingi, hindi naman nakikita nila yun Sa Canada, nilagyan na nila ng graphic health warning. Dito, hindi pa. Sinunod ng DTI, lagyan ng graphic health warning. Pero pumunta kayo sa probinsya, nagkalat ang vape, nakatabi sa mga candy, nakatabi sa mga laruan. Sa murang bata, akala nila, ay para sa amin yan. We need a lot of, surveillance, knowledge, educate. Ang punto naman namin dyan let's protect the children kasi sila talaga ang heavily affected. Yung adults na nagsiswitch sa vape, yaan na andun sila sa ibang level. Yan, pwede yan sa DOH quit line. We need a thorough understanding what happened to the history of our tobacco and vape law para alam din natin ang pro-health laws na hihingin natin at isusulong sa ating mga kandidato.
Thank you, Doc Riz. We have a question from Rappler.
Hello. I'm Casey. I'm from Rappler. I just have two questions. The first one is for Mr. Montesa. I know AER released a statement on this a couple of days ago, but how were you able to arrive to the figure na 1.1 trillion pesos yung what we lose? What the contributing factors, the specifics. And then my second question for anyone in the panel. I think, it's documented that part of Philippine culture is yung drinking, sometimes smoking. So how are we going to affect this cultural change in mindset? I know the DepEd has introduced a program to try to educate younger people about effects of tobacco and alcohol consumption. But are these programs working? Are there changes that we want to implement on this?
Thank you. Go ahead, AJ.
Yes, thank you for that question. So yung numero po na binigay natin, 1.05 trillion ang total economic cost ng tobacco and alcohol. How did we arrive here? The concept of economic cost includes yung healthcare expenditure, yung gastos ng paggamot sa mga sakit na dulot ng tobacco at ng alak. Pero we have to also account for things like lost productivity. Ibig sabihin nito, may mga taong mamamatay ng maaga, no? People who are otherwise healthy, for example, pero dahil sila ay naninigarilyo o nagkukonsumo ng alak, ay posible magkasakit sa atay, sa lungs, posible magkaroon ng cancer, no? So these people lose their lives. You can account for how much GDP would have been earned if buhay pa yung taong iyon. There are people who, although they don't die, they get sick enough na they lose their economic productivity. They have to call in sick to work more frequently. They have to have caregivers to take care of them, no? So all of these factors into economic cost. Nandun din yung concept ng externalities. Na-mention kanina yung second-hand smoke. Diba? Kahit hindi ka naninigarilyo, ikaw ay posible magkasakit. Sa alcohol, merong road crashes, may domestic violence. No? So all of these, when you account for all of these things, may metric that's called the DALY or the Disability Adjusted Life Year that accounts for all of this. It's a lost year of healthy life. And when you value that based on GDP per capita, you will arrive at the 1.05 trillion, which accounts for the direct health cost and the indirect health cost of lost productivity and lost lives. Your second question, sorry, what was the
Drinking culture, Filipino drinking culture.
Yan. Very important question yan, no? Noong, siguro, I will acknowledge the fact na noong unang panahon, nung wala pa yung mga alcohol industry, part talaga ng culture natin yung pag-iinom ng alak, no, culturally. But nag-iba yung situation nang nagkaroon ng mass production, no? When you have the alcohol industry mass producing and marketing these products, no? So instead of only drinking alcohol during certain occasions, no, they are marketing it in such a way na you will associate alcohol with, for example, always you have to drink it in a social gathering. Always you have to drink it when there's a special occasion, whether good or bad, no? So we have to rethink that. We have to rethink the marketing, yung culture natin. Kailangan ng strict regulations. One example is the success of tobacco. I'm not sure kung naabutan niyo po ito nung, I think yung generation ng magulang ko or ng magulang ko, normal ang manigarilyo everywhere. Even on airplanes, pwede ka manigarilyo, di ba? Pero that changed, di ba? Nagbago yun. Naban yung advertising. Wala ka nang makikitang commercial ng tobacco or ng billboard ng tobacco. So it's not normal anymore to smoke. But vaping is very in now because there's marketing on vaping. Ganon din sana sa alak. Unfortunately, ironically, mag-drive ka sa highway, sa SLEX, may billboard ng alcohol. Ironic yun, drive safely, tas ang nakalagay, alak, alcohol, di ba? So, may role to play talaga yung government regulation in regulating how the industry is able to market and also how the industry is able to lobby. I think we should also have more transparency with how the industry relates to politicians. Dapat alam natin kung sino-sino sponsoran ng mga tobacco and alcohol companies sa mga politiko natin. So, in changing the culture, one step that we can take is changing policy, changing regulations, and increasing taxes so that it's not as accessible to people.
Ayun, increasing taxes, no? Doc RJ, something
Oo, super nag-agree ako dun sa point ni AJ. Grabe yung galamay ng industriya, no, para impluwensyahan yung perception ng mga tao regarding alcohol, tobacco, and vape, no. At tingin natin na ito ay isang propaganda, no, ng industriya. So ginawa nilang cool, ginawa nilang part of the culture kuno, 'di ba? And dagdag na ito doon sa lobbying efforts nila at doon sa pag-influensya doon sa evidence na meron tayo. Kasi I think ngayon marami ring efforts, no, to influence the evidence. May mga researches silang pinopondohan, may mga activities silang sponsorships, no, even to some medical societies that we have to really push back upon, no. So tingin ko parang kailangan may justice angle dito sa issue na ito because alam natin walang health benefit at all yung tobacco, yung vape at yung alak. Kaya nga yung tanong ko rin kasi kanina na-mention yung yung lapses dun sa tax laws natin. Are we taxing the industry enough, no? Knowing na wala siyang kahit anong benefit. And considering yung conversation kanina on gender-based violence, on mental health, may mga invisible costs tayo na hindi na-factor dun sa conversation. So we have to really rethink, no? At any effort to push back, to roll back actually, yung mga increase natin dun sa health taxes natin is a social injustice, I think, no? On top of producing harms to young people.
Thank you, Doc RJ. Doc Cory?
Hi. So, on a personal note, you were saying kasi about culture. So, if my dad were alive, he would have been 100. He used to smoke. He stopped cold turkey because meron nagka-emphysema namatay. But he proudly would tell me, I started smoking when I was already working. So yung mindset niya was more of money. So he brought me up saying, I don't care if you smoke, just don't burn my money. So yun yung culture before. So ngayon, gusto natin palitan yung mindset ng mga tao. That's why we have that tagline, not one puff ever. And as I said earlier, it goes for any bisyo. Be it drugs, be it vape, be it cigarillo, be it alcohol. So as we're calling for this day nga, raise the taxes. Kasi yun lang talaga naman ang one of the subok na tutulong para sa atin.
Thank you so much, Doc Cory. I apologize but we have time for one final question. If ever may gustong magpahabol. Okay. Siguro kung wala, yes, pahabol, one last. Thank you. Go ahead, ma'am.
Good morning. Good morning po. Nes Aguilar from the Philippine Event News TV. With regards po dito sa Syntax Coalition, ang gusto ko lang po itanong, kasi yung title po niyo, End the Epidemic. So, paano po natin mai-end ang epidemic kung ang negosyo po ng karamihan po kasi na nagne-negosyo ng yosi o e-cigarette, vape, or wines, mga legal. So, and at the same time, nagkalat din sila everywhere. Nagkalat din sila online. Nagkalat din sila sa advertisement, TV, radio, so forth and so on. Even my son, high school pala, nagbe-vape na. Hindi ko na maiwasan. Myself, nag-yosi ako pero tinanggal ko because since nasa media po kami, very stressful. Kaya lang, it affects my health. So, I think yung pong, nasa tao rin po yun sa pagtanggal ng bisyo. Di ba po? Even myself na, ako po yung, na-try ko pong talagang dahan-dahan na matanggal. So, ang tanong ko po, paano po natin maiiwasan yung epidemic nito? kahit nasaan, andyan sila.
Okay,
Salamat
thank
po.
you. Sige, I'll give it to RJ, AJ, RJ also. So specifically, yung call natin, what are the steps in order to end the epidemic among young people? Thank you, ma'am.
Actually, recognize po natin na yan, no? Yung mga behaviors natin, mahirap talaga sila baguhin, no? Pero mas mahirap sila lalo kung merong aggressive measures, no, to market, no, yung mga produktong ito. Lalo na, nasabi niyo po, talamak sila, no? And it really highlights the importance of addressing this problem urgently. Kaya po yung panawagan ng organizations po namin, kasama yung iba't ibang medical societies dito, is to end the pandemic, end the epidemic, by actually holding leaders accountable and monitoring. Sino ba dito sa mga kandidatong ito yung consistent doon sa stances nila, no? Siyempre gusto natin yung mga kandidato natin ay pro-health, pro-people, kasi at the end of the day, yung gobyerno po natin yung merong responsibilidad. Malaki yung responsibilidad nila doon sa pagprotekta ng kalusugan natin. So, kumbaga, individual actions are good, pero siyempre, mas gusto natin yung mas systemic na interventions para protektahan yung kalusugan po natin. Ayun.
Ayun. Thank you, AJ.
Salamat po sa katanungan po. No? I understand po, nagagaling po kayo sa mga personal experiences ninyo. Nag-agree po kami na kailangan din ma-address yun. And yung pinaka-call po natin talaga ay kailangan umakto yung gobyerno natin, lalo na yung mga kandidato ngayong 2025 dahil sila po ay tumatakbo para maging bahagi ng gobyerno natin. No? So, nandito po sa manifesto, meron po tayong panawagan sa mga kandidato. So, number 1, para wakasan po yung epidemya ng Yossi Vape at alak, kailangan taasan ang buwis. Na mention po namin kanina, masyado pang mura ang alak at tobacco. So much so na yung mga estudyante ay kayang bilhin ito. Mas mura po siya than a value meal. Kapag mura siya, halimbawa sa ibang bansa katulad ng Singapore o New Zealand o Canada, sobrang mahal po ng produktong ito na yung mga estudyante, hindi sila nagsisimula ng bata pa sila. So, important po iyon, no? One factor din po yung mga mahihirap, no? Imbis na magsimula sila uminom ng alak o manigarilyo o mag-vape, dahil mahal po masyado ito, mas uunahin po nila bumili ng pagkain na lamang, no? So, important ang pagtaatas ng buwis. Pangalawa, kailangan ng comprehensive regulation policy. So dito po pumapasok yung sinabi po natin kanina na ayusin po yung vape law, yung mga flavors, yung advertising, yung marketing, yung age, yung minimum age, no, na ma-access ito. Bahagi po yun ng comprehensive na regulation policy na parehas sa alak at sa tobacco, kailangan po ayusin iyon. Kasama din po doon ang enforcement. Para saan pa ang magandang batas kung hindi po siya ini-enforce ng maayos po, no? At lastly, dahil ito ay hamon sa mga kandidato, hinahamon po natin sila na maging pro-health, no? Ipakita na hindi sila pumapanig sa industriya ng tobacco at ng alak, kundi ay pinoprotektahan po nila ang public health ng mamamayang Pilipino. So, dapat po tayo, mga botante po tayo, hingin po natin yun sa kandidato na ano ba yung plataforma ninyo na para sa kalusugan, na para i-improve yung healthcare system natin. Tanungin natin, ano ba yung smoking cessation programs na gagawin natin? Ano ba yung programs natin para i-stop yung youth na mag-vape at uminom ng alcohol, no? So, part po ng program na ito na talagang hamunin yung mga kandidato na isama yung health dahil part yun ng isa sa mga pangunahing concerns ng mga botante ayon sa mga survey na ang health ay dapat i-prioritize po, no? So yun lamang.
Maraming salamat. That ends our open forum and press conference today. What we will do now is that if you have side interviews with our resource persons, you may coordinate with them, or nandyan din po si Franco and Justin to assist. So let me just summarize, no? Malaking pahamak ang Yossi, vape at alak. This is well-established evidence. Sa laki ng pahamak nito, there is an epidemic among young people, and we need to address this through taxation, imposing taxes on these products in order to protect young people and the Filipino public, calling on also our candidates and duty bearers and the government to take a stand and protect public health. Thank you, Dr. Hector Santos ng Philippine Medical Association. Thank you, AJ Montesa from the Action for Economic Reforms. Thank you, Doc Riz Gonzalez, Philippine Pediatric Society, Dr. Cory Avancenia ng Philippine Academy of Pediatric Pulmonologists, Ms. Reby Relator ng Parents Against Vape, at Dr. RJ Nagit ng Philippine Society of Public Health Physicians. Maraming salamat din sa mga miyembro ng media na nandito ngayon at ating mga health advocates. Lunch is served. Thank you so much.